everyone. I'd like to welcome you to this webcast. I'm Alexa Siegfried, and my colleague Lucy Rocha and I have been invited by the California Primary Care Association to present this webcast about the Rural Telehealth Toolkit, focusing on telehealth models for workforce development. The Rural Telehealth Toolkit was developed by the Walsh Center for Rural Health Analysis in collaboration with the Rural Health Information Hub. I will begin with some introductions. Lucy Rocha is my colleague and a research scientist at NORC and the Walsh Center for Rural Health Analysis. Her research focuses on the root causes of health inequity and rural healthcare access and delivery. Lucy will introduce you to the Rural Telehealth Toolkit. My name is Alexa Siegfried, and I'm a research scientist at NORC and the Walsh Center. My research focuses on the public health system supporting local, state, tribal, and territorial health departments. I conduct program evaluations on topics including rural health, public health systems, transportation, and public health preparedness. I will introduce you to NORC, the Walsh Center, and the Rural Health Information Hub. The NORC Walsh Center for Rural Health Analysis has been the home for rural health research, evaluation, and program support at NORC at the University of Chicago since 2003. We conduct research to improve the health and well-being of rural communities. NORC at the University of Chicago is an objective, nonpartisan research organization established in 1941 that conducts research and analysis that decision makers can trust to guide critical programmatic, business, and policy decisions. We partner with government, corporate, and nonprofit clients around the world to provide the objectivity and expertise necessary to inform the critical decisions facing society today. The Rural Health Information Hub, RHI Hub for short, is your first stop for rural health information. It is funded by the Federal Office of Rural Health Policy. The RHI Hub website offers an online library with information and resources covering a wide range of rural health issues and an extensive funding section. The website also has more than 50 topic guides covering topics like telehealth use in rural healthcare and other relevant rural health topics. The RHI Hub website also features state guides covering the status of rural health in each state, rural data visualizations with county-level data, program models with replication principles and program contacts, an online magazine, and more. NORC has a collaborative partnership with RHI Hub to conduct work to establish the rural evidence base. This includes the development of evidence-based toolkits, including the Rural Telehealth Toolkit that we're sharing with you today. These toolkits guide communities in their efforts to improve health outcomes. In total, the RHI Hub website hosts more than 20 evidence-based toolkits to help build community health programs in rural areas. Now, I will hand it over to Lucy, who will introduce you to the Rural Telehealth Toolkit.
Thank you so much. As Alexa mentioned, the Rural Telehealth Toolkit includes a wealth of information and resources that can support your organization in implementing telehealth programs in rural communities. Today, I'm going to focus on a couple of models that use telehealth to improve rural workforce development. First, telehealth can be an important tool to promote workforce education and training in rural areas. And that's because some rural providers face difficulties in traveling long distances or missing work to receive continuing education and professional development. Through telehealth, rural providers can receive mentoring, demonstrate their skill acquisition, and even participate in role-playing exercises like mock code simulations. So one example of an evidence-based program to develop the rural workforce is Project ECHO, which stands for Extension for Community Healthcare Outcomes. In this model, providers in university medical centers and other specialty care institutions use video conferencing technology to meet with rural providers on a regular basis to review cases. Through Project ECHO, rural providers can receive guidance on treatment plans and build capacity to treat patients in their own communities. And one example of a Project ECHO program is the Mountain West AIDS Education and Training Center, which uses ECHO to train rural providers in HIV patient care. And providers meet weekly with HIV specialists through video conferencing to discuss cases and to discuss treatment protocols. Telehealth can also be used to promote workforce retention and recruitment, which can be crucial in rural communities that are facing workforce shortages. So, for example, telehealth can allow advanced practice clinicians, technicians, and other providers to work at the top of their license under remote supervision from a physician or a pharmacist. Telehealth can also prevent burnout by offering support and decreasing isolation for providers who would otherwise be on call because of workforce shortages. Some rural hospitals and clinics also recruit providers by offering full-time or part-time telecommuting privileges. A great example of using telehealth for workforce recruitment is the North Dakota Telepharmacy project. And this program was developed because North Dakota was experiencing many difficulties in recruiting pharmacists to serve in rural and frontier communities. The model allows licensed pharmacists to supervise registered pharmacy technicians at rural sites. The licensed pharmacist provides drug use reviews and verifies all prescriptions filled by the pharmacy technician. And pharmacists also provide one-on-one patient counseling through live video telehealth. Telepharmacies have served 80,000 rural residents of North Dakota and created between 80 and 100 new jobs in rural communities. So in addition to the Rural Telehealth Toolkit, the Rural Health Information Hub also offers many other resources that provide information about telehealth programs. First, RHI Hub includes more than 35 examples of rural communities that have implemented telehealth programs. These models and innovation pages describe the intervention, discuss evaluation findings, and provide helpful considerations for replication. Second, RHI Hub offers more than 600 resources related to rural telehealth. These include reports, fact sheets, maps, videos, and websites, among many others. And finally, RHI Hub also developed a rural telehealth topic guide that includes up-to-date information about grants and funding opportunities from the federal government, state agencies, foundations, and more. Thank you so much for listening to this webcast. Please check out the Rural Telehealth Toolkit and all the other great telehealth resources on the Rural Health Information Hub. And please feel free to reach out to us by email if you have any questions about the toolkit.